Hello, my name is Julianne, and this video is covering how to perform an upper GI study with barium. I did not have a real GI case to practice this study, but I am using Brooks the Rottweiler to practice my radiographic views. Indications to look for in a GI series are reoccurring vomiting, diarrhea, hematemesis, anorexia, mass lesions, wall distortions or lesions, melena, abdominal organ displacement, chronic weight loss, persistent abdominal pain, foreign bodies or obstruction, and inconclusive results of a survey radiograph. Contraindications to look for are if the animal has fluid-filled distended esophagus or stomach, if the bowel is atomic, ileus due to torsion. To prep the patient, the area being radiographed should not have any radiodense artifacts, including food, bowel contents, and gas, that could be misdiagnosed as lesions and abnormalities. If the animal is not anorectic or vomiting, fast at least 12 hours prior to administration of the contrast meal. Fasting for 24 hours is best if mucosal disease of the small intestine is being evaluated. If an enema is required, as indicated by the survey radiograph, administer at least 2 to 4 hours prior to the procedure to minimize gas artifacts. If the patient has severe abdominal stress, neither fasting nor an enema or laxative is suggested. Survey radiographs have lateral and ventrodorsal radiographs prior to administration of the enema. Precautions to think of before proceeding with the study is if rupture or perforation is suspected, use water-soluble organic iodides, but in dehydrated patients, avoid the use of such agents. Ultrasonography would be overall safer for diagnosis in compromised patients. Delay the study if the stomach is full of ingesta. The use of barium in gastric dilation / volvulus, chronic obstructive bowel disease, and paralytic ileus cases are complicated. Gastric dissension is not recommended immediately after gastric surgery or deep biopsy. Prior use of tranquilizing or other drugs affects the transit time. If tranquilization is required in morphological studies, consider acetopromazine for dogs and ketamine for cats. If possible, avoid parasympatholytic agents and drugs used for treatment in GI disorders, which may cause gaseous distension or decrease motility prior to the contrast study. Use of anticholinergics should be suspended at least 24 hours, though preferably 48 to 72 hours prior to administration of contrast media. If Brooks were a real case, I would choose barium sulfate as my contrast agent, 3 to 5 mL per kg for dogs over 40 kilograms, and he is 42.3. The suspension form of barium is the positive contrast agent generally used because its particles do not flocculate or separate. The barium sulfate does not settle upon standing, so the suspension should be shaken prior to use. Barium sulfate is not hypertonic and does not increase the intraluminal fluid. A disadvantage is slow transit time through the small bowel. Chilling the barium sulfate for an upper GI study does not speed up the transit time. However, for a lower GI study, the barium temperature between room and body temperature is more comfortable for the patient. Obviously, I ran out of time in my video again, but there's still more to talk about. For administration, prior to administration of the barium, have everything ready, such as image receptors in position, technique set, protective gear, animal near the table, etc. If administering the barium with the patient on the table, keep in mind that the barium spillage will create artifacts in the image. I would also drop a few 60 cc syringes and having 170 cc's drawn up in total. For positioning when radiographing the abdomen, you are measuring at the thickest part where the liver is located and at the thoracolumbar junction. The central ray should be centered over the caudal aspect of the 13th rib in the dog. For Brooks, I had him set to 80 kVp and 10 MAS, and making sure that my label is either on the right or the left side. As for the time intervals when administering the barium, I would be using a syringe, administering barium sulfate. Be aware that an orogastric tube if it is not used, barium may leave the stomach before all of the agent is administered, meaning that the stomach will not have optimal distension. At 15 minutes post-administration, take a VD in a lateral right, then 30 minutes post-administration, another VD in lateral right, 60 minutes pass, VD lateral right, and then hourly post-administration, take VD in lateral right views until the study is complete. The 15-minute radiographs may be eliminated in dogs depending on the nature of the study, but are highly recommended in cats because of the rapid GI transit time. An extra radiograph at 90 minutes may also reveal further information for the cat. The gastrogram is finished when the majority of the barium is not visible in the stomach. The small bowel study ends when there is little evidence of barium in the small intestine.